Hello everybody, myself Dr. NEETU MODGIL. I'm ENT consultant in Hyderabad, India. Today I want to talk about nasal polyps. We know about nasal allergy, allergic rhinitis, sinusitis, but the most important problem is nasal polyps. Polyps are allergic reaction. It can happen usually due to allergy. They arise from the sinuses, come into the nose. There are various types of polyps. It can be fungal, it can be allergic, it can be endocrine polyp, it can be ethmoidal polyp. All these are medical terms beyond the realms of you to understand. Why I took these names? To you to understand that every polyp is not same. There are various causes behind the polyps. Accordingly, various names for the nasal polyps. The problem with the patients of polyps are that when they get operated, they start having the polyps after a few months or a year later too. So these patients are really having a bad life. They come to us like third surgery, fourth surgery. Recurrent surgeries happen in their lifetime. And they always say that the doctor did not operate me well. I started having the polyps again. You cannot blame the doctors. With the polyps it has a genetic predisposition. Patients with genetic predisposition develop polyps in the nose. Sometimes we see a patient with complete nasal blockage for 5 to 6 years, breathing from mouth only, lot of sneezing. They do not have polyps. It means that patient who has allergy, who has nasal blockage, that patient is supposed to develop polyps. It means that it has a genetic predisposition. That patient is not having a genetic predisposition to develop the sinuses, to develop the polyps in the sinuses. If any patient or you are having polyps in the nose, it means there is a genetic role behind it. You are prone to develop the polyps in the nose. The problem is how to treat it. For treating the polyps, first of all, we need to remove the polyps. Now question arises, if I go for surgery, doctor, can I get a lifelong relief? Answer is no. We are clearing the sinuses of the polyps so that we can take care of the sinuses in a better manner. Because when there are polyps in the nose, we cannot penetrate our sprays, our wash inside the nose into the sinuses. First of all, we need to remove the polyps so that we can reach the sinuses with our sprays and our washes. So the surgery role is only 30%. Even after excessive take care, even being so vigilant about your treatment, very rarely 2 to 5% of the patients may have polyps again. That is sad. But 95% of the patients after the polyp surgery, if they take care of the nose properly, as advised by the doctor, they need to wash their nose every day for 3 to 6 months. There are various medications to wash the nose. They need to spray steroids in the nose. It can be from 6 months to 2 years. There may be a need for short-term oral steroids like 3 weeks, maybe 2 or 3 times a day, depending on the intensity and the severity of the polyps. Taking care of the nose and sinuses in a holistic manner, being regular in your sleep, being regular in your washes, being regular in your walk and your exercise, in your diet, everything play a role. So when you take care of your sinuses properly, as advised by the sinus surgeon, you come for the checkup regularly, you take care of those days when you are more allergic, you will not have polyps again. They need lot of efforts from your side. The surgeon work is only 30%. You can avoid recurrence of polyps by properly taking care of the sinuses. So that's why we have to fight together for sinuses. It's not only the surgeon's role. It's not the fault of doctor that you get the polyps again. The doctor's work is to remove the polyps, to help you clear the sinuses, take care of the sinuses properly at home. Thank you so much.